So what we're going to do now is the voice box goes like, okay, now I want to tense up myself and then I'll relax myself. I've had a tough day. I need to yawn and then release. So the vocal cords, to cause them to tense and relax, which muscles will be used? Now, let's talk about a muscle between the thyroid and cricoid cartilage, because this area has been filled with muscles for now, right? So let's fill up this area as well, because this area is like, hello, I exist. Can you please help me too? The cricoid and thyroid, between them runs the muscle, the cricothyroid muscle. When there is a pull in the cricothyroid muscle within your laryngeal cavity, suppose this is the vocal process. If you're going to cause pull to the thyroid cartilage, these vocal cords will get stretched, because these are the tensors of the vocal cords. We are talking about the cricothyroid muscle is the tensor of the vocal cord, and a second name for it is that it's the tuning fork of the larynx. The origin of it is from the lamina of the cricoid cartilage on its lateral surface, and it goes up to attach to the inferior cornua of the thyroid cartilage. If you all remember, I've already talked about this muscle before. That makes complete sense. Moving on, what about the relaxation? So obviously we'll need a muscle to perform the opposite of cricothyroid. If this is pulling it downwards, we need something to pull the thyroid cartilage towards the larynx, like basically causing compression of the larynx so that the tension of the vocal cords is released. And what muscle better to do that than something running from the thyroid to the arytenoid cartilage? What do you think the muscle will be called? Obviously thyroarytenoid muscle. This muscle runs from the angle of the thyroid cartilage all the way to the anterolateral surface of the arytenoid cartilage. And with a push of this muscle, your vocal cord that was tensed, it will all of a sudden relax. All right, the vocal cords will relax. So the relaxer of the vocal cord is the thyroarytenoid muscle, which means it runs between thyroid and arytenoid bone. So this is basically how you're going to learn these muscles. They just make sense. Their movements make complete sense, right? And their names are named after where they run from, where they run to. Another relaxer is the vocalis. If you can add that, that'd be brilliant, because the vocalis has the same route from the thyroid to the arytenoid. Elevator and depressors of the larynx. Now these are mostly unrelated to the laryngeal. They're not internal laryngeal muscles. They are the other muscles. Any muscle that runs above the thyroid is going to be its elevator. Anything that runs below the thyroid will be its depressor. So what lies above the thyroid? We have this hyoid bone, and then we have the mandible bone. So we need a muscle that connects the thyroid cartilage to these bones so that we can elevate the larynx. So what better muscle to do that than the thyrohyoid and the mylohyoid, which is mandible to hyoid. Basically, when the mandible causes a lift in the hyoid bone, it also causes a reflex lift in the larynx as well, because they're all interconnected, right? So the mylohyoid and the thyrohyoid, these two muscles are going to cause a good elevation of the larynx. The larynx will be like, finally I can stand up after a difficult day of tensing my vocal cords. And the depressors of the larynx, we have a sternum lying below this entire neck area. So obviously anything from the sternum is going to cause that pull. So the thyroid and the sternum should be connected. This is the sternothyroid, the name says it. And another muscle called the sternohyoid will do the same action, depressing the larynx. The larynx says, okay, I've stood up enough, let's sit down for a while. And therefore the depressors, sternothyroid, sternohyoid, come in reaction, right? The next are the easiest, opening and closing the larynx. We've already discussed this before. Anything that needs to open the laryngeal inlet has to be linked to epiglottis. That's the first thing we all know. Anything linked to the epiglottis is going to be related to opening or closing the larynx, right? So anything that's connected from the thyroid to epiglottis is going to open the larynx, because it's going to pull the epiglottis towards this side, and this is the inlet of the larynx. So anything connected between the epiglottis to the arytenoid is obviously going to close the larynx. So I guess I don't need to explain that much. We all know that the opener of the larynx is the thyroepiglottic muscle. The muscle that closes the larynx, inlet of the larynx, is going to be the aryepiglottic muscle. So the closer is the aryepiglottic muscle. Let's talk about the origin and insertion. So one thing I want you to know, that the thyroepiglottic muscle and the aryepiglottic muscles, both, they like to take benefit of the other muscles. They're like, if the other muscles, there's so many muscles that are originating, inserting, then why should we have our own origin and insertion? Therefore, the thyroepiglottic muscle comes from the fibers of the thyroarytenoid muscle, whereas the aryepiglottic muscle comes from the fibers of the oblique arytenoid muscle. Thyroarytenoid muscle is a muscle that's already going posteriorly towards arytenoid. So the thyroarytenoid muscle says, fine, since you're going posteriorly to, here you go, some of my fibers. So the thyroepiglottic originates from the fibers of the arytenoid muscle. Whereas the aryepiglottic muscle, since the oblique arytenoid is also linked up to the arytenoids, so aryepiglottic muscle takes benefit of that and takes the fibers of the oblique arytenoid and goes and becomes the aryepiglottic muscle and closes the epiglottis. So these two muscles, that's their origins and insertion. So well done. Those were the most important muscles of the larynx. Now I just want you to know all of these are intrinsic muscles except for the cricothyroid, which is an extrinsic muscle of the larynx. So you can already see it's outside, whereas others are lying inside. And this nerve supply also differs because of this. All of these muscles are supplied by the recurrent laryngeal nerve except for that extrinsic muscle. Since it's extrinsic, it is going to be supplied by what? Obviously, the external laryngeal nerve. All are branches of the vagus nerve. Alright? That is the motor supply of your larynx. With that, let's talk about the sensory supply of the larynx, which is again very easy. Recurrent laryngeal nerve is the major supply of the larynx. And below the vocal folds, the sensory supply is going to be given by the recurrent laryngeal nerve. Above the vocal folds, the sensory supply will be given by what nerve would be responsible for supplying an inside area of the larynx? There's just one nerve left, and that is the internal laryngeal nerve. So everybody got a duty. The internal laryngeal nerve, external laryngeal nerve, recurrent laryngeal nerve, they have to supply, right? So recurrent laryngeal nerve is already dominating. It has supplied all the muscles. So the internal and external laryngeal nerves are like, hello, we're so bored. Can you give us some work too? Can you divide something? So the recurrent laryngeal nerve goes like, fine, external laryngeal, you can have the extrinsic muscle, and internal laryngeal, you can have the sensory supply above the vocal folds. Alright, blood supply of the larynx, again very simple. Above the vocal cord, superior laryngeal artery and vein, whereas below is the inferior laryngeal artery and vein. So if there is damage to the internal laryngeal nerve, there will be anesthesia to the supraglottic part of the larynx. And when there is damage to the external laryngeal nerve, it will result in weakness of producing voice or phonation. And that's because external laryngeal nerve is a very important supplying the cricothyroid, which is the tensor of the vocal cords. And without tensing the vocal cords, most of the phonation will be lost. And apart from that, if the recurrent laryngeal nerve is damaged, then I'm sorry to say, we all know most of the muscles are lost. There will be hoarseness of the voice, especially if there is unilateral paralysis. There are two recurrent laryngeal nerves. If there is one-sided paralysis, it will result in hoarseness and difficulty of speech. But if both are paralyzed, we all know that is going to be really, we don't even want to talk about how much damage that will cause, right? Since the right recurrent laryngeal nerve arises in the neck, whereas left in the chest, if there is a disease called the mediastinal syndrome where your mediastinum is affected, which is lying in the thorax, then the left recurrent laryngeal nerve will undergo damage, right will escape the damage because it arises in the neck. And with that, guess what? You have completed the larynx and now you're a master in it. I really hope you understood well. Subscribe to my channel. Until next time, thank you so much for watching.